So my name's David, and I want to talk to you about CardiCare, which is a solution that we developed as a team of engineers, doctors, and business people. But before I get into that, I want to talk to you about Raj. So Raj is a typical Indian family man. He's middle income, middle-aged, and up until recently, he thought he was fairly healthy. Unfortunately, he was admitted to hospital with a flare of his heart failure about a month ago. It was very stressful for his family. It was, as we would imagine, a big burden on the health system as well to treat people with these kinds of severe flares of heart failure. So, Raj shares this diagnosis with about 23 million other people in India by conservative estimates. This is a graph of this is basically a graph of what chronic diseases look like across the world. And in Raj's case, the dips in the graph would represent flares of heart failure and ultimately would lead to his death at the end if they're left untreated long enough. And our solution hopes to reduce the severity of these dips and also to reduce the frequency of them. So we want to present a software solution which would hopefully help manage post-discharge care of heart failure patients. And I'll hand over to Sue to explain how we're going to do that.
Hi everyone. So CardiCare will be first introduced to the patients when they visit a doctor for heart failure. There's two main interfaces, a patient mobile and also a web platform for the doctors to access the patient information. So now I'll go through a live demo of this that we built over the weekend. So here you can see a patient going through and answering a series of clinically relevant and evidence-based questions. They're very interactive and simple to use. Once they answer these questions, they will then come and view immediate feedback on their results. They'll be able to link back to the goals that they've set out and view tips as well to help manage their care. So on the other end, here we have what's a really big value add in terms of the information that gets sent back to the doctor. We're using the traffic light system to help doctors prioritize patient load and efficient time allocation. When you go into the dashboard, there's a lot of rich data that doctors will not be able to get without CardiCare through the patient's own self-monitoring input. And I'll hand over to Luca to talk about the business model.
Thanks, Sue. So in regards to our business model, we'll be looking to partner with cardiology clinics and hospitals across India who currently face the economic burden of this problem. It amounts to approximately $6 billion AUD annually. So in terms of the sustainability, we can grow the scope in two ways. The first would be preventative intervention, and the second would be expansion into other underserved and emerging geographies, and treatment of other chronic diseases such as kidney disease. So what does the future look like for CardiCare? Well, we'd like to refine the tech alpha you witnessed just now in the 90-day plan, and begin legal and accounting guidelines conversations. Post that, we'd like to secure some grant money and look into the viability of starting local trials in India. Thank you.
Great work. You've already got a demo going. That's pretty cool. So talk to me about the decision to start at the point that they've had an incident. Like, what made you focus at that point versus
Sure. So chronic disease is quite tricky to manage, particularly because patients can steadily lose motivation as the chronic disease progresses. That gives us a good starting point in that it's something that's easy to manage. So it's easy to go to a cardiologist and say, when this patient comes in with heart failure, that's when we want them to have the app. And it's also probably the point of maximal motivation. Once a patient has been admitted with a severe flare of heart failure, if you've ever seen it in hospital, you can tell a lot of these patients who will do anything to not have that happen again. And it's often described as looking like a fish out of water when they have an episode of pulmonary edema. So I think this is the point of maximum motivation for the patients, and it would be our starting point, but eventually we go back and try and tackle some preventative and some earlier care as well.
So I thought that was great. One thing I was considering was what proportion, so you said I think 24 million people in India get heart failure, which is a very large number of people. So what proportion of those people will actually have access to the sort of care you're talking about where an app would be useful?
So smartphone penetration is actually pretty good in India. From what we could find, it was about 40% of people in India will have a smartphone. That's the current estimate, and that's just projected to increase as well. It's actually quite a young disease in India, heart failure, as opposed to how it is in Australia. Instead of a median age in the 70s, the median age is in the early 50s. And additionally, with the strong familial links in India, we think that we can get younger members of the family to assist in data entry as well for the for older patients as well that have the diagnosis of heart failure.
A very big challenge in India, and it's exactly the work that the George Institute does. We have a thing called Smart Health, where we're looking at rolling out NCD tools to the people which don't get them at the moment, so they're very keen on this idea. Have you thought of the business model? Because this is always a challenge in India.
Sorry, could I get you to refine in regards to business model? You're looking at how to monetize?
Yeah, the payer model. Who pays for it?
Sure. So the payers would be the clinical stakeholders, effectively. So a lot of it is cost inefficiencies in the market, which we could likely get subsidies for from the people funding the clinical hospitals and whatnot. Beyond that, we didn't really touch on it just because we don't have a legal counsel right now, but there is always the avenue to monetize the data in terms of there's currently nobody in India collecting this level of data in heart failure patients. So there's avenues you could monetize the data in terms of pharmaceutical companies, insurance companies and whatnot, but the legal concerns that we didn't want to touch on is just around anonymising the sensitive and vulnerable populations. So if we could address that, it's absolutely an avenue for monetization.